and their communities. And the most amazing thing is that up to very recently, this condition was completely hidden. It was not talked about. It was sort of taken for granted that a certain amount of women will get this condition in childbirth, and then they will just be put aside. But UNFPA started a campaign to end fistula together with many other partners. And action is actually really taking place. And so now, today, we have 45 countries in Africa, Asia, and Arab region who are, actually doing very concrete things to treat fistula and also, importantly, to prevent it in the first place. And so this is not only an improvement in the health of the girls and the women, but actually restoring dignity of girls and women and in being able to face a future with some degree of confidence. And here you see these young girls from Liberia. I actually was there a few months ago at exactly this spot, and maybe I'm actually taking the picture. And the girls are an example of the unfortunate number of very young girls who get pregnant. This is, they've gotten fistula, they got all fistula, but thank God there is a program in Liberia which we have been supporting to, repair have the surgery available to repair the fistula, and very importantly, to also give some skills and a confidence for these girls that they can go back to their communities and be stronger and be in charge of their own lives. So that was, seeing the girls and being with them was something you will never forget. I was also really struck by the fact that they look so young and they are so young. And that's after they have had a pregnancy and almost died of a pregnancy. So that's an illustration of a good thing that at least we saved these women, but every year more than 500,000 women continue to die during pregnancy and childbirth. And largely, these are from problems that we can prevent. We know what to do, and therefore it is true that maternal mortality remains the biggest or the largest health inequity in the world. And it's the goal, the maternal mortality goal of the Millennium Development Goals is the one that's lagging the furthest behind. So the least progress has been made on that so far. So in other words, of all health indicators, maternal mortality displays the biggest or the largest gap between the rich and the poor, both within a society and also between countries. And just to give you an indication, some of you know these figures, but here in the Netherlands, for example, the risk of a woman dying as a result of pregnancy and childbirth during her lifetime, the lifetime risk, is 1 in 10,000. Actually, it's 1 in 10,200. So, very rare event, which is what we want. Now, then on the other side, you have many countries such as Niger, where that same indicator is 1 in 7. 1 in every 7 women is likely to die because of childbirth or pregnancy during her lifetime. So it's a huge issue which also isn't being given the attention it requires. And young girls obviously are at much greater risk. They're not yet ready in physical terms, basically, even if you don't talk about anything else. Physically, they're not able to have a pregnancy that will succeed in medical terms. So here, because this is such a neglected issue and it requires a lot of political attention, I want to just mention that your government, the Netherlands government, has taken a very important initiative. They are putting this high on political discussions in the international arena. And as part of that, together with UNFPA, the Dutch government is sponsoring a high-level event on maternal mortality next month in Addis Ababa, where different governments and different partners will come together. So that's an example of a very important way in which we can contribute to making advancements on issues that are basically still a little bit invisible or not given the kind of attention, particularly at times when there are other issues also that are crowding the public attention and the political attention. Basically, there are 3 interventions that we know work for better maternal health. And these are, first of all, voluntary family planning, so that those who don't want to get pregnant are able to delay or postpone or avoid pregnancy. Second, for those who are pregnant, that they have skilled care during the delivery. So basically, in most places, this would mean a midwife, like here. And thirdly, for those who actually experience a complication, that there is availability or transport to an emergency care. So there are 3 proven interventions. And maybe interesting to note here that it's estimated that ensuring access to family planning could reduce maternal deaths by 25 to 40%. So it's a big part. And child deaths by as much as 20%. So again, it's not often understood that making family planning available is not just a choice that we want people to have. It actually avoids deaths of children and deaths of infants and deaths of mothers. So that is very important for us to recall. Now, as you can see from the next slide, the percentage of women using modern contraception does vary greatly across regions. So we see here that the use is highest in Asia, then followed by Latin America and Caribbean, South Asia, and the least is Sub-Saharan Africa still. But also important to recall at the same time is that while in some cases and in some regions in particular there is low use of family planning, there also exists a demonstrated, we know, unmet need for family planning. So when you ask women, young people, couples, would you want to use family planning if you could have access to that? They will definitely say yes, a large number will. About 200 million women actually today would want to use family planning, but they are not because they, for whatever reason, are not able to access safe and effective contraception of their choice. Sometimes they may have access to one method, but it's not the one that they want. And as you can see from the next